Good evening, everyone. Welcome to the Boulder County Board of Health regular meeting, January 16th, 2024. It is 5:31, and we're doing a fully virtual meeting this evening due to weather and road conditions. And before we start down the agenda, I'd love for the board members to introduce themselves, please, and to take roll call here. So this is Morgan McMillan. I'm the board president.
Brooke Harrison, board member.
Lindy Hinman, board member.
Amber Johnson, board member.
Vice President Fagan. We can't hear you, Landry. I can see you, but I can't hear you.
Okay.
So nothing. Okay, you work on it.
So Vice President Fagan is present too. Thank you. Okay, so we're going to start with item number 1, public comments, and I'm going to read a brief statement before inviting members of the public who are here to comment. The Board of Health provides the opportunity for the public to share their viewpoints and opinion on public health matters. It is not the practice of the Board of Health or agency staff, many of whom are top experts in the field, to review, vet for accuracy or grounding in scientific evidence, or provide responses to public comments at Board of Health meetings. Opinions expressed by the public should not necessarily be interpreted as accurate if staff or the board does not challenge that perspective. Thank you.
Thank you. All right, we have 3 members of the public signed up to speak. I see 2 online right now, so we'll go ahead and get started. The first is Leslie Glustrom. So Leslie, I'm going to make you a presenter. That will allow you to turn on your camera and your mic, and your 3 minutes will start whenever you're ready.
I apologize. It took me a little while to see where I do all of that. Thank you so much, members of the board and President McMillan and all the members. My name is Leslie Glustrom. I live in Boulder, have for 25 years, something like that, maybe more. And I'm trained as a chemist and a biochemist, but for the last 20 years, I have been working on climate change. I resigned my research job at CU to work full-time on climate change. I've spent a lot of that time at the Public Utilities Commission, working with the Boulder City Council, working with the state legislature, but this is my first time to a Board of Health meeting. So I thank you for this opportunity. I have been trying since 2015 to help Boulder County take a more active oversight role on the 1 million tons of coal ash that exist just east of 63rd Street, just north of the Valmont station, which used to have the coal plant. That coal plant shut down in 2017, so I began in 2015, knowing that was going to happen, trying to get the county to, like, what are we going to do? How are we going to decommission it? What do we do about the waste? And I don't know how many emails I've sent, but it's an awful lot. I think now, we've had an incredible story about Boulder Reporting Lab with, just true investigative journalism. They hired a contractor, Downstream Strategies. We know we have 1 million tons of coal ash. We know our groundwater is contaminated with arsenic, molybdenum, cobalt, and several other things that are very serious. You're public health professionals, so you can understand. Obviously, the plume is moving off-site to the north and the east. There are residences there. There are farms there that will go unnamed, but we clearly don't want the produce coming into the farmers market to be irrigated with water that contains cobalt and arsenic and molybdenum and a lot of other things. So I'm asking you, Commissioner Levy, Counter Commissioner Levy said, well, I think it's a Board of Health issue. So I'm a little worried that this is happening, right? It's a Board of Health, it's a county commissioner issue. So I'm just asking that you all coordinate, you designate a lead staff, you take a very active oversight role, Lots of people you can talk to. The consultant that Boulder Reporting Lab hired, Downstream Strategies, excuse me, 1 second. The EPA, CDPHE, Excel do this in a very public way so Excel knows you're watching. It would be nice to just ignore the fact that we have 1 million tons of coal ash just a little bit east of the
30
city of Boulder.
seconds.
Thank you. But obviously, if you ignore a problem, it does not go away. So I get that it's a little complicated, but there are lots of ways to start. You can start talking to Boulder Reporting Lab Stacy Feldman, who's made herself quite an expert on this. She's a nationally renowned journalist who's come to our city, which I'm so grateful for. And then, as I say, go on to EPA, CDPHE, hold public meetings, make sure that Excel knows you're paying attention,
That's
make
fine.
sure that the community is engaged, and preferably start monitoring the wells yourself, possibly getting some federal money because we're a coal community as much as we don't like to admit it. So thank you for your time.
Thank you.
Thanks, Leslie. Thanks for your advocacy and attention to this. And I was pleased to see in the director's report that I think is attached and available through the public health meeting notes that public health is continuing to work with Oscar to try to address some of this too. So thanks for your comments this evening.
Next, we have Carolyn Benensky. So Carolyn, I'm going to make you a presenter, and your 3 minutes will start whenever you're ready. Hi, Carolyn. I can see you.
Hi, my name is Carolyn Beninsky and I live in Boulder. And I submitted this testimony to you earlier in writing today, so you have the citations that I'm going to be referencing. I urge the Board of Health to do your own research into the very significant dangers and ineffectiveness of the COVID vaccines. You have a moral responsibility and a public duty to do this since BCPH is still recommending that everyone over 6 months of age gets the shots and is providing the shots to uninsured and underinsured adults, low-income children, and others. The Board of Health and the BCPH continue to follow the recommendations of the CDC, the FDA, the CDPHE, and other national and state agencies, in spite of the fact that there is massive evidence which grows every day that the shots are toxic, dangerous, and ineffective. It is a well-documented fact that the federal agencies are in bed with the drug companies and that there is a revolving door between the agencies and the federal health agencies. Since COVID is now a mild disease, there is no reason for anyone to be taking these unnecessary and dangerous shots. It's time for you to stop recommending them and stop giving them to low-income people. There are recent books that lay out the danger of these products. The first is Neither Safe Nor Effective, The Evidence Against the COVID Vaccines in 700 plus medical studies, second edition by Colleen Huber. And this includes studies in prestigious medical journals that are highly critical of the COVID vaccines, both on safety and efficacy. The second book available online for free is mRNA Vaccine Toxicity by the Doctors for COVID Ethics, and you can get that online. I've given you the link there. I urge you to do your own research and learn the truth about the immense harms caused by these shots and to stop recommending them. The following is an excerpt from the preface of the second book, the mRNA Vaccine Toxicity, and it's
30 seconds.
We make the case that in spite of a conspiracy of silence and censorship in the media and much of the scientific establishment, the damage done by the COVID-19 mRNA vaccines is now clear and beyond doubt. This assessment is supported both by statistical evidence and by pathological findings on autopsy and biopsy materials from vaccine victims. So please stop giving
That's
shots
time.
to low income and stop recommending them. Thank you.
Thanks, Carolyn.
Thank you.
We had one other person signed up, but I do not see them on our attendees list. So that concludes public comment.
Sorry, just had to navigate back to microphone there. Okay, thank you very much, members of the public. Item number 2 on the agenda is approval of the December 11th, 2023 regular meeting minutes.
This is Brooke, and I move that we approve the December regular meeting minutes.
Second, this is Landry, I second.
Great, thank you. We have a motion and a second. All in favor?
Aye.
Aye. Okay, great. Thank you. Meeting minutes are approved. Item number 3, 2024 Boulder County Legislative Priorities Approval.
Good evening, Board of Directors. This is Lexi Nolan, BCPH Executive Director. I use she, her pronouns. Thank you for being with us tonight, everyone. We are looking forward to sharing with you, particularly with our county guests, the county's legislative priorities and a little additional conversation on how public health continues to work in the policy space.
Thanks for the introduction, Lexi. My name is Nick Robles, policy analyst. I use he, him pronouns. I'm joined by Mike Rosen, policy team lead. So the policy team is pleased to be able to present to the Board of Health team update today. Our fellow policy team members, Summer Laws and Cindy Copeland, are not joining us today, unfortunately. So during the interim of 2023, policy team met with staff and commissioners and developed the 2024 state legislative and budget priorities, which was approved by the Boulder County Commissioners on November 30th. So tonight we will discuss the highlights of this document as well as other updates related to the legislative session that just started last week. And now I will pass it to Mark. And next slide, please.
I believe you're muted, Mark.
Right.
There we go.
Making the old rookie mistake. It's only been how long that we've been on virtual? Well, I just wanted to say thank you for this opportunity. We always appreciate the opportunity to come speak to the Board of Health and typically do that in January of the new year. And then year round, we so value the working relationship we have with Boulder County Public Health staff and the assistance and guidance and direction and collaboration that you all provide to our team here in the Commissioner's office is appreciated and valued and helps us be successful down at the state capitol and the other places that we advocate for county priorities. Nick and I wanted to just spend a little bit of time talking about the legislative session, which, as Nick noted, started last week, and talk a little bit about the priorities that the county commissioners have adopted for 2024. And just as a quick background, the commissioners adopt legislative priorities every year. In large part, that's because as a statutory subdivision of the state, county governments exist to provide state services, and it's very important for our residents and our communities to be engaged with and aware of the work that's happening down in Denver that can influence the work that happens in our communities. We, over the years, have had great leadership, both at the commissioner level and at the Board of Health level and in our legislative delegation. And you can see from this slide, the 8 members of the General Assembly that represent some portion of Boulder County. Most of our representatives, their districts are entirely within the county, but a couple cross county lines, in particular the Senate districts. As you can see there, the session runs for 120 days, 120 days of pure fun, and started last Wednesday. Will run through the early part of May. You're probably aware that there are 100 members of the General Assembly. If we add the members of the Senate and the House of Representatives. Current political makeup of the General Assembly is 69 Democrats and 31 Republicans across both chambers. So it's what you would call a supermajority in the House of Representatives, with 46 of the 65 members Democrats, and almost a supermajority in the Senate with 23 of the 35 members Democrats. So majorities that have been unseen in certainly modern days, and which give the General Assembly, the Democrats, the majority party, in collaboration with the governor, the ability to move a lot of legislation forward. Over the course of the session, we'll see about 600 pieces of legislation introduced. And in addition to the state budget process that will happen beginning in March, and it's the General Assembly's responsibility to adopt the state budget. One last thing I wanted to mention before we move into the priorities is that new this year for the Commissioner's Office policy team is the commissioners themselves have appointed leads in 15 different policy areas. And the idea here is that we as staff are going to be working closely with the commissioner lead in any particular policy area to help advance the county's lobbying and advocacy strategy. So engaging one-on-one with the commissioner to get into more of some of the more tactical decisions about how we lobby particular bills and the role that the commissioners can play in that effort. All the commissioners are excited and interested in being part of the lobby team, and we think this model and this way we've organized ourselves will help us be more effective and efficient down in Denver, and to get the commissioners directly engaged with the work. And I'll quickly note that Commissioner Levy is the Community Health and Wellbeing Commissioner lead, and will likely, and Nick is the staff lead in that area, and will likely have the chance to work with Commissioner Levy on some of the issues that are top priorities for Boulder County Public Health. So I'll say advance the slide and pass the floor back to Nick.
You're muted, Nick.
Yes, got too excited. Sorry about that. Okay, so yes, we'll talk a little bit about, I'll talk about the legislative principles, and then Mark will talk about the legislative priorities. So yeah, these principles guide the policy team and county staff in the development of the positions that the county takes on state legislation. The legislative principles also serve as a guidepost for examining the outcomes of potential legislation. As you can see, we have 3 principles. In terms of racial equity, just some of the highlights would be that, you know, we recognize that as a government, we have the responsibility to interrupt institutional racism in the way it manifests through racial policy, practices, and behaviors. And also just, yeah, we review all of legislation introduced, and we review it through a lens of racial equity. And we try to strive to solicit the voices and perspectives of those historically excluded from the legislative process. In terms of the principle of climate action and environmental justice, we definitely look to promote sustainability, address the climate crisis, and improve air quality, as well as address the inequitable impacts of climate crisis and pollution. And for our last legislative principle, financial and organizational stewardship, we'd like to work collaboratively with local, regional, and statewide partners, as well as advocate for reform state revenue structure. And I'll just quickly note that, yes, these 3 principles also reflect pretty closely the commissioner's strategic priorities. I'll just read those off as well. So commissioner's strategic priority number 1, economic security and social stability. Strategic priority 2, climate action and environmental stewardship. And strategic priority 3, good governance. Thank you. I'll pass it to Mark for the legislative priorities.
Thank you, Nick. And in the packet for the board meeting this evening, you'll have a copy of the 2024 Boulder County State Legislative and Budget Priorities that were adopted by the commissioners, as Nick noted, back in November. I won't go through all of these priorities, but rather just touch on a few of the ones that are going to be, I don't want to say higher priorities, but which we'll be most certainly actively engaging with. And some of these priorities are priorities that were developed as a result of 2023 legislation. And as Nick noted, the process in the summer that county staff engaged with in setting our own priorities, but also engaging with work that the General Assembly was doing in the summer through what are called interim committees. One I wanted to call out is work that Cindy Copeland is leading in the space of air quality and ozone reduction. The county actively supported legislation in 2023 that created an interim committee to look at air quality and ozone. Significant frustration in various stakeholder groups across the state around the relative inaction of the state in dealing with the the state's ozone issue, in particular along the Front Range. And so this committee in the summer worked through a number of bill priorities, and we'll see 3 to 5 bills coming out of that group that will work on the issue of air quality and ozone reduction. And tied to that is the role that environmental justice will play in this space, looking to advance recommendations that have come forward from the General Assembly's Environmental Justice Task Force, and really to try to take some action that addresses the air quality and ozone impacts that we're seeing in heavily impacted vulnerable communities, in particular those that are located near refineries and other oil and gas production facilities. Health and well-being, community health as well. As part of that, we'll see some legislation to reduce gun violence prevention. We'll see legislation in the space of gender affirming care and opioid and other substance use disorders. So we're looking forward to engage with the legislation that's happening in those policy areas. Nick is leading our work in that space. And again, some of this came out of work that an interim committee, in particular on the opioid issues, was working on, and your staff have been involved in those conversations over the summer. If you saw any highlights from the governor's State of the State address from last week, I don't remember the exact number, but I believe he said housing or some iteration of housing something like 40 times in the course of the State of the State address. We know that housing and affordable housing will be a priority. I should say that for the county, it most certainly is an emphasis on the affordable housing component of the housing conversations that will happen down at the General Assembly. This will take place in the form of land use legislation and other strategies that will see the state play a more significant role in local land use planning and the implementation of comprehensive plans and zoning plans and other planning efforts that local governments take to plan for their communities. The need for affordable housing in particular is significant across the state, as you all are familiar with, and the General Assembly will most definitely be active in this space during the session. They were able to make some progress last session in 2023, but the primary vehicle they were engaging with and working on failed, and they're picking up the pieces from that. And I can say so far so good in respect to how they're moving forward, and a lot of conversations still to be had, but we're in a better place than we were a year ago, most certainly. Summer Laws leads our work in the human services space, and that includes a lot of work that happens in respect to child welfare, and we'll certainly be engaging in legislation that looks to support a provision of access to benefits and child welfare in general, and including policy and funding to address racial, ethnic, sexual orientation, gender identity, and other equity issues in the child welfare system. Language justice and language access is a big priority for the county as well this session, and looking to ensure that we're having full language access and language justice in all spheres of life, including the child welfare system, but also in professional licensing, for example, and the early childhood care system. Lots of spaces to make improvements there. And then lastly, kind of the companion piece to housing, and this desire to see more people living in places where they can access transportation without having to own a car, is the issue of transit funding. and looking to make improvements in both the amount of transit funding and how transit funding is directed to support the reduction of single occupancy vehicles and provide multimodal opportunities for people to access the services they need, access their places of employment, and build communities that are not so auto dependent. So that's a quick snapshot of the state legislative priorities, and pass for the next slide, and Nick's going to walk us through budget priorities.
Yes, thank you. So the policy team works closely with the county's fiscal lobbyists, a firm called Policy Matters, and they help us ensure the state budget includes provisions that addresses the county's fiscal needs. And because the county administers statewide programs, much of the funding to operate those programs comes from state appropriations. Our team's engagement with the state budgeting process begins the year prior to any legislative session, and we work with other partners to share county priorities with state departments, key stakeholders, and the legislature's Joint Budget Committee. We continue our advocacy efforts through the development of the governor's budget, the budget supplemental process, and the development and passage of the long bill. So I'll just touch real quickly on some of these budget priorities that we highlighted from the document. In terms of air quality, we see that we want to be able to support the governor's budget request of about $14 million for funding for programs that reduce air pollution and greenhouse gas emissions and implement and enforce environmental justice initiatives. For food access, we want to support funding and other efforts to ensure equitable food access for children and adults in Colorado, especially as food prices and other basic living costs continue to rise. Mark already touched a little bit on housing, but we want to be able to support the governor's budget request of about $35 million to provide funding for affordable housing tax credits and infrastructure funding for transit-oriented community housing. In terms of funding for local public health agencies and the state health department, we want to support the governor's budget request of $15 million to continue investment in Colorado's public health infrastructure. Happy that the governor's budget request recognizes that strengthening our public health infrastructure is critical not just for COVID-19 response, but also for the long term. In terms of mental and behavioral health, we want to support the Child Welfare System Interim Study Committee High Acuity Crisis for Children and Youth Bill, as well as the governor's budget request of $29 million to increase the access to high levels of care and child welfare placements for children and youth. And Mark touched a little bit on transportation, but yes, also want to support the request related to permanent funding for the free transit services to improve air quality and youth access to transit, as well as supporting that package related to housing and transportation to further development of transit-oriented communities. We can move to the next slide, please.
And thank you for that, Nick. And just wanted to close with one last slide here about that talks about the way we do our work and those we partner with. The county's advocacy work at the Capitol is really built on a foundation of collaboration and coalitions. The commissioners and staff help direct the lobbying work taken by the 3 membership organizations there that you see, as these partnership efforts are critical to amplifying the county's voice and influence at the Capitol. We also collaborate with a wide variety of stakeholder groups and partner organizations, like the ones you see listed on the slide, including CalFO. Working with these organizations, especially those that are community-led by people of color and people who face discrimination, help us guide our approach to our legislative work and help us meet our legislative principle of racial equity. And lastly, if you're going to engage in work at the General Assembly, you need to be engaging with the state administration. At the end of the day, the governor's office and various state departments need to be partners and need to be comfortable with the work that you're proposing, the changes that you're proposing, the state law. And so we spend a lot of time working with the administration as well in this space. So just wanted to note for you all that, as I said at the beginning, the partnerships we have with BCPH and your staff and with the organizations listed on this slide are really critical to moving our priorities forward and doing it in a way that ensures that we're meeting not just specific and perhaps narrow county needs, but also the needs of constituents that we serve both within the county and outside the county. So with that, Nick and I are happy to answer questions or be a resource for you as the conversation here continues.
Great, thanks, Mark and Nick. And it's so nice to see so many smart and strategic people that are former public health staffers on your team, so including Nick. So thanks for doing your great advocacy on our behalf, in addition to the rest of the county issues too. Do any board members have any questions? No specific questions. Okay. And again, I'll just note, I'm really pleased and appreciate the support of you all, your team, Mark, and the commissioners in supporting those budget increases from the governor's office. That could be really key to our agency and other local public health agencies around the county. And again, just really appreciate the energy you all put into a very busy session. And then the rest of the year too, all the work that goes into getting ready for the session. So thanks very much for sharing with us this evening.
So I think we're going to transition over to some internal policy efforts in BCPH. And at the conclusion, we will ask the Board of Health if they would like to endorse the county policy priorities for our own agency.
So you don't need a vote from us on this piece of it, Lexi. You're gonna.
It will be a vote on this piece.
Right, but are you gonna? There's other presentations.
There's a couple more slides.
Great. Okay. Thank you.
Can we advance the slides? Yeah. Go ahead, Heather.
Thank you. Good evening, board. Heather Crate, they, them, theirs with the Community Health Division. Just wanted to remind you all, refresh you as we jump into the new legislative session about some of our internal policy work and efforts. So myself and Lane Drager from Environmental Health are currently co-leading our internal policy efforts for the agency with a lot of help from all of our amazing staff who engage in the work as well. But we are starting to kick off next week with our bi-weekly internal policy meetings where we organize and share, track, and discuss all of the legislation that we are tracking, more specifically related to public health. In addition to that, Lane and I continue to attend, along with other staff from BCPH, the BOCC or the county policy team meetings, both the human services and the more environmental health focused, climate justice focused policy team. The CALFO policy committee or the Colorado Association of Local Public Health Officials policy committee. We are not voting members this year, but we are able to attend and share perspective. And then we also attend, along with several other staff, the Colorado Public Health Association Policy Committee, where if staff are members of CPHA, they can vote in that committee. I will say CALFO is really focused on public health infrastructure, whereas CPH Policy Committee, we are able to bring in a bit more of the social justice, health equity, social determinants of health discussions around policy and addressing those. And then in addition to that, we have a lot of our coalitions and our stakeholder groups who are also providing a lot of input and a lot of perspective. In particular, our substance use advisory group continues to provide a lot of insight around opioid legislation, substance use legislation in general. Next slide, please. We continue to have some future goals, as Lane Drager and myself do still have full-time jobs here at Public Health. We are hopeful in the future that we will be able to have a full-time policy position who can work in close partnership and continued partnership with not only the BOCC policy team, but all of those external partners that we shared to take over that coordination of the policy committee and some of that internal work. We'd really love to have the capacity to move into more proactive efforts. Right now, just given limited capacity, we tend to be more reactive to bills that other folks are drafting and introducing. We would love to be on the front end and be able to help draft and introduce legislation that benefits our community. And also that would give us more capacity to work on local, municipal, and city county policy as well if we had someone dedicated. This would also just help with stronger coordination across the agency between our community health assessments, improvement plans, strategic plan, policy efforts, just a key person to really bridge all of the work across the agency. Although I do have to say, after just 1 year of having our internal policy committee, I do think we were able to align a lot more strategically around our efforts. And in future years, we want to, in addition to the BOCC legislative priorities, be able to drill down a little more specifically to some really tailored BCPH legislative priorities that we can identify, because as you heard Mark and Nick give the overview of the BOCC legislative priorities, they're very big and broad and all-encompassing, which is really great because that helps us be able to respond and work in a lot of areas. And also it would be nice to have some more specific areas identified. Next slide. So this is the piece. I will kick it back to you, Lexi, if you want to propose this, or I can propose it.
Go for it, Heather.
Okay, great. So similar to previous years for folks who've been on the board historically, I know we have at least one new member. What we tend to do for our policy efforts at BCPH is that we ask that the board vote to adopt the yearly BOCC legislative priorities. So for this year, it would be the 2024 BOCC legislative priority areas. Those are the areas that were just presented on. So the climate action, health and well-being, housing, child welfare, language justice, and transportation. That way we as staff at BCPH under Lexi's leadership have your blessing to move forward and advocate on behalf of policy to promote public health in those areas. Because the legislative session does move so quickly, having this blanket approval on those topic areas really helps us to be able to respond in a timely manner as bills come up in committee. So that is our ask this evening, is for you to adopt the 2024 BOCC legislative priorities. Any questions?
Okay, thanks, Heather, for your work and Lane's work and the team's work on that too, and on behalf of the department. And I think, one thing that I think came up last year, and there was some efforts in the past just to let the board know if there are specific bills that are coming up that either we could help by further promoting further advocacy around, advocating directly as a board or as individuals. It's nice for us to know about that. And I know we often receive updates throughout the session too of bill status, but that's just a nice way for the board to stay engaged on what is going through the state as well. Great. Okay, so thanks to everybody for your work, and I think we need a motion to adopt the 2024 BOCC legislative priorities, please.
I move to adopt the BOCC for legislation priorities of 2024.
I second.
A motion and a second. All in favor? Aye.
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 Okay. Great, then the adoption passes. And again, thanks for all of the work that goes into it.
Thank you very much.
Thank you.
Special
Okay,
thanks to our guests, Mark and Nick, who we missed from his days working at BCPH. Thank you for joining us tonight.
Thank you so much. So great to see everyone.
yeah, thanks and good luck with the session.
Yes, thank you.
Thank you.
Okay, item number 4 on the agenda is a community health divisional update.
We are very pleased this month to spotlight our community health division, who does some of the most historically innovative work in our agency and really leans into equity work in a way that few public health programs in the country have the opportunity to. And so I'm looking forward to hearing their presentation this evening. Thank you.
All right, well, thank you again. I'm here with my other hat on as the Community Health Division Manager. Again, I'm Heather Crate, they, them. Next slide, please. I just want to take a minute or two to introduce the work that we do as community health. I know that we sent quite a bit of background information to the board. Hopefully you had a chance to read through some of that, but just wanted to really center in the work and our approach from the Community Health Division. And similar to other facets and programs within BCPH, we center health and racial equity in all that we do, in our relationships with each other as a division, in the work that we do, in the frameworks and approaches that we use in working with our community. We power share and work in partnership with our community. As Lexi said, we have a lot of really innovative homegrown programs that have been cutting edge and developed homegrown within the community by the community as a response to community need. Several of our programs, Genesis and Oasis in particular, have been around since the early 90s. And all of our programs continue to develop and evolve based on what our community wants to see. One thing that we're really proud of is that our staff represent the communities that we serve. Our staff reflect the sexual orientations, gender identities, racial and ethnic makeup, language, communities that we live in, of the communities that we serve. And that's really intentional around how we hire, how we do our work. It's definitely not by accident that we want to reflect those that we serve. And one of the ways that we do the great work that we do, and some of the stories that you'll hear tonight, is that we focus on addressing a wide range of health outcomes at the individual level, at the community level. So through coalition work, through organizing groups of young people, at the institutional level, through work with our schools, with our hospitals, with our health facilities. And at the policy level, as you just heard about, we advocate strongly. A lot of our staff and clients and participants and community members advocate at the state level for the amazing work and public health approaches that we take within community health. So I'm actually going to hand it off to all of my amazing colleagues who are joining me tonight, and we're going to tell you a bit about the work that we do. So I am going to hand it over to Jax first.
Good evening, everyone. Could you go to the next slide for me, please? Thank you. My name is Jax Gonzalez. I work with the prevention program for LGBTQ youth at BCPH. And tonight I'll give context for why we focus on power building through social consciousness education. So we know that the best way to improve health outcomes for our most marginalized community members is to create the conditions for them to take part in building a world they dream of. And social consciousness education, or what we call socio-political development, increases self-advocacy skills, reduces depression and anxiety, and stigma for marginalized identities, It also increases empathy, enhances academic achievement, and promotes resilience for marginalized youth. So with that in mind, I'd like to introduce Jude Clinchard, who will share some examples of this work. Jude, go ahead.
Thanks, Jax. Hi, y'all. My name is Jude Clinchard, and I'm one of the 2 youth advisors for Oasis. Primarily, my work consists of managing our social media, offering youth perspectives, and most importantly, managing our youth group, Youth Advocating for Change, or YAC. YAC is a group of LGBTQ+ youth who work towards justice through education, advocacy, and community building. As a leader in our YAC group, I have gained extensive knowledge and experience on how important advocacy is as a young person. My particular group within YAC right now is working on a legislative workshop that will aid in educating LGBTQ+ youth about using our voices to make change in Colorado's legislature, on a statewide scale. Having the opportunity to lead other youth and educate them and aid in reaching their own goals has been a gift. One of the members actually entered YAC wanting to learn more about the legislative process and has already expressed feeling like they are more knowledgeable and are eager to keep learning. Another member had expressed needing to learn how to be an advocate in the first place and was pretty quiet for our first few months of YAC. And now I've kind of seen them open up and come out of their shell. They're speaking more in groups and really offering valuable insight. Seeing the positive changes that YAC has created for the youth who participate is super inspiring for me. I've been an advocate since I was 9 years old, and being part of the Oasis team and leading YAC has allowed me to offer my insight. This, Sorry.
Is muted. This meeting is being recorded and or.
1 second, I'll look through who needs to be muted.
And leading YAC, and it's allowed me to offer my insight and emphasize my voice as a young person to further make change and better the community of Boulder County. Thank you for your time tonight. I'm going to hand it off to Elia Bereza as our next speaker.
Next slide, please. Good evening, board and community members. My name is Elia Barraza. I am the Generations Program Manager, and I use she, her, ella pronouns. I'd like to introduce you to Ashley and share a little bit about her and the tremendous strides she's made in her life. Ashley is a second-term member of the Generations Leaders Organizing Cohort, also known as GLOW. GLOW has given her the opportunity to overcome her fear of public speaking through her participation in the Spring Service Learning Project. This project was an in-person presentation to engage with Spanish-speaking parents on how they can support youth who are exploring their gender identity and sexual orientation. While in GLOW, Ashley has made new friends and she steps out of her comfort zone by volunteering for learning opportunities. Ashley shared that one of the most difficult challenges in her life was when her family lost everything in a house fire a few years ago. This experience helped her appreciate her family and the value in togetherness after it brought them closer. This experience also showed her how a neighborhood, the schools, and the community can come together to support her and her family. Ashley is passionate about mental health, and she has been an advocate for her own mental health and working on overcoming social anxiety. She has found her voice during meetings, and she has been a role model to fellow Generations youth. Ashley has been attending online school for 4 years, and she is now considering taking a challenging step towards enrolling in in-person schooling in the fall. The GLOW project she enjoyed the most was the youth mental health project that included the creation of a video to help inform adults about mental health challenges youth experience. Even while experiencing many hardships and overcoming personal obstacles, Ashley has been resilient and she has quickly flourished into an active and engaging youth. We look forward to watching Ashley discover her strengths so she can continue thriving. Thank you for the space to share and highlight our youth and programming, and I will now hand it over to Casey.
Muted.
Next slide, please. So my name is Casey Pierce. My pronouns are she, her, and they. Thank you for having me tonight. I am the program manager for the Tobacco Education and Prevention Partnership.
Sorry, Casey.
program.
I can't hear you at all. You're unmuted, but it's so quiet. I can't hear it.
Okay, can you hear me better now?
Yeah.
Okay, great. Again, my name is Casey Pierce, and my pronouns are she, her, and they. I'm the program manager for the Tobacco Education and Prevention Partnership Program in Community Health, TEP. Cigarette butts are known to be the #1 littered item in the world, and as vapings become more popular, particularly as they become more disposable, we've seen vape product waste issues. Vape product waste become an issue. Vape product waste environmental risks may be apparent to some. E-cigarette components such as cartridges, batteries, and plastic casings, they're damaging to the environment. They don't biodegrade, and they break down into toxin-laden microplastics, and they're disproportionately concentrated in and around areas where tobacco products are sold. Now, vape product waste are also environmental justice issues. The tobacco industry has intentionally and aggressively targeted communities of color with their products for decades, with more retailers in these areas than others. Additionally, research shows that more vape shops are in close proximity to schools, specifically in school districts with high proportions of Asian and Black or African American students. The TEP received funding to do innovative grant work through the state to address these environmental risks and environmental justice issues. We really wanted to work to innovatively break down those silos, and we're currently partnering and doing so with Hazardous Materials Management Facility here in Boulder County, as well as 9 vape shops throughout the community and schools. Additional vape shops have actually reached out to us in our program to ask to participate in the work. They've indicated that they want to actively contribute to environmental sustainability and community well-being, and they're committed to responsible business practices to mitigate environmental impact. I'm very proud to say that not only is our program seeing participation from our own community, but other counties' TEP programs are leaning on our expertise in the area as well. One school in California reached out to us for our guidance on the topic, and an individual recently traveling through Colorado on vacation actually stopped by the Hazardous Materials Management Facility to drop off personal vape waste. They actually heard about the program on a wider level and even paid the individual fee that they were charged as an individual trying to dispose those materials. So overall, super excited and proud of our programming and the things we're able to do, and we'd love to share more at any time. I will now hand it over to Mary.
Hi, if you'll advance the slide, please. My name is Mary Faltinsky, and I'm the Genesis Program Director. And tonight I wanted to give you just like a little image of what it is that we do in our home visiting program. And so I'm going to tell you about a client, Elizabeth. To give you an example of particularly high-risk clients that we are seeing. So Elizabeth is not typical. Most of our clients are born and raised here in Boulder County, but Elizabeth came from Guatemala. In 2023, we saw a significant increase in migrants from Central and South America coming in and participating in the Genesis program. Elizabeth was high risk. She was uninsured. She had a ninth grade education at entry. She had no extended family in the county, and she scored elevated for depression at program entry. So we were able to connect her to a whole host of services. And what I wanted to say is what the health outcomes we've accomplished with Elizabeth. So she was able to get counseling in her home during and after her pregnancy. She got her COVID vaccine during her pregnancy. She had a baby with a healthy birth weight. She breastfed that baby until age 2. Her child received all immunizations due prior to age 2 through their medical provider, Salud. This child has remained on track for development. The families received high scores on parent-child interaction. Mother and father are both working full-time, and the child is in high-quality daycare at the Wild Plum Center in Longmont. So that's just a little image of what an intensive program can do. I want to thank you for your support of a teen parent focused program, acknowledging that there are unique and important challenges among teen parents. And next we'll pass it to Allison.
Thanks, Mary. Good evening. My name is Allison Bailey. I use she, her, hers. I manage the Community Substance Abuse Prevention and Inspire Youth Connections programs. You can go to the next slide, Dahlia. Thanks. So I wanted to share an example with you this evening of some of our work in community power sharing. In community health overall, we've worked really hard to ensure that youth and our community partners are part of our staff hiring processes. And recently we had an example where we took this to the next level. So we had a vacancy for the Lafayette Communities That Care program in the community mobilizer position, which is basically the facilitator of that coalition. And we wanted to make sure that the hiring process was a true partnership between public health as the backbone agency and the members of the coalition. So we worked with the county HR department to make sure that the position was classified in a way and with language that was inclusive of lived experience of applicants. We also made sure that our coalition members had access to NeoGov, which is our hiring platform. So we made sure that everyone had a login to be able to participate in that system. And so our coalition members identified priorities and needs of the position. We worked together to co-create and approve the job description. We worked to create interview questions together. We screened all the applications, and we had coalition members, including youth, participate in every step of the interview process. So because of these efforts, which took more effort on the part of our HR department, our personnel team, our staff, and also of our coalition members, and it took a little bit more time to make sure that we were being really intentional about this process. Because of all this, community voice was centered in this hiring process. And as a result, we have a community mobilizer for the Lafayette Communities That Care Coalition that the coalition is invested in. And it also increased transparency of the hiring process at BCPH for our coalition members. So we're really proud of the outcome and the process that we went through. And I'll pass it off to Heather to finish this up.
Next slide, please. So we hope that those vignettes and stories of some of the ways that our community and our young folks and families engage with our programs helps to paint a picture as to the ways that community health engages across our community in a variety of ways and aspects that go beyond just the data, the wonderful data that we have about our programs. But we wanted to share some of those stories with you about the different ways that we engage and just wanted to open it up for any questions or comments from the board. And thank you for your time.
Thanks so much, Heather and team. I want to just first ask if any board members have any questions.
I was just say thanks, team. That was amazing. Yeah, to hear all those stories and really specific examples of the people that your programs are reaching. I had two quick questions. One, for the vape stores that are cooperating with your programming, like what is the benefit to them, or like what is sort of like the motivating factor for them to participate with the programming?
We can't hear you, Casey.
Can you? I feel like it's a 90s Verizon commercial. Can you hear me now? So the vape community, the vape shop community that we work with, they are all individuals who want to do the right thing, right? They want to participate in this on their own accord, right? They're saying, we want to do this because we know it's good for our community. And I think that that's the great thing. We haven't been like, you need to do this or been forceful with them. We've had conversations that have just been like, hey, this is what vape product waste can do to the community. And these are the ways that you can participate in making a difference in that. And so those vape shops have willingly come forward and said, yeah, let's do this. We'll partner with this. And so what we've done is we bring a container that those materials can go into, and they collect from whoever it wants to bring them in, any of their customers that are going to bring those in. And once that container is full, then we have a company that brings it back to our hazardous materials facility, and then that is processed through there. And so really, it really is just because they want to do the right thing, if that answers your question.
It does, thank you. I just have one. That question, it was exciting to hear about the power sharing hiring practices that you guys were modeling. But as you noted, that is time intensive, right? It's time and staff intensive in order to sort of support that model. I would be interested in moving forward just to hear lessons learned or advice that your group might have on like those hiring practices. I mean, I think that certainly, hopefully this is going to become best practice in this space. But as you've noted, I mean, the intensive time and resources that are required need to be modeled in a sustainable way.
I have a feeling that this team could put together a list of lessons like that already pretty quickly. And you're right, Amber, that it does take time, and the more you do it, the better you get at it. And I think it's also tied to the county's interest in greater community engagement. So it's possible that those lessons that we could gather together could be useful in the conversation with the community about how do we start doing more power sharing and community engagement within other departments too. Mm-hmm. So thanks for that suggestion.
Yeah, and I think we could really outline a variety of approaches, all the way from how do you start with just maybe involving community members on your interview panel, all the way to sort of the model that Allison laid out with that deeper power sharing engagement. I think there can be smaller steps too that we take. And I know that's some of the discussion we've had as an agency.
Yeah, I just want to take a moment again to thank everyone and all of the presenters, and in particular, I think, is it Jude, the young person who participated this evening to share about some of your work. So really appreciate the opportunity to learn more about all of the various programs and accomplishments, and you know, as public health identifies mental and behavioral health as a key priority for us in our strategic plan and in our ongoing work, and just how important it is to focus our efforts and really lift up communities that have long been ignored or marginalized, and just really proud to hear all of the great empowerment work that's happening. So thank you for your leadership on that. There are no other questions from the board. I will say again, thank you, and appreciate all your time this evening.
Thank you all.
It's going to take me a second to toggle back here to the agenda. Agenda item number 5, strategic plan, feedback and edits.
Thank you. We are very pleased to be able to share kind of a draft strategic plan with you all at this Board of Health session. As you know, this has been an ongoing project for us, and a lot of work has gone into it. And we are hopeful to follow the same process that we did with the Public Health Improvement Plan, to do a quick high-level review of what's in the plan, and answer any questions we can tonight, receive additional feedback and questions, and come back to you next month if that's appropriate. And at this point, I am very pleased to turn it over to Elise Walm and Rachel Mental.
I will happily turn it back to Rachel Mintle, our
There you
health
go.
planner, who will be presenting.
Thank you.
But thank you, Lexi.
Awesome. Thank you for the introduction. Good evening, everyone. My name is Rachel Mintle. I use she, her pronouns. I'm the health planner in our health planning and evaluation program. And as Elise already chimed in, she's with me as well, our health planning and evaluation program manager. So tonight, as Lexi said, we're excited to share with you that we have our draft 2024 through 2029 strategic plan. You all received the draft plan in your Board of Health packet, as well as a lengthier presentation providing a little bit more context to the plan. Tonight, I just wanted to touch on a few key points before opening it up to you all to hear your initial feedback and questions. So I will try to kind of breeze through relatively quickly in the interest of time. Dahlia, if you could go to the next slide, please. So before jumping into the strategic plan itself, I just wanted to ensure we're on the same page in terms of definitions, specifically with goal and objective, knowing that people define them differently. We can define them differently. But in our strategic plan, our goals are the outcomes that we want to achieve over a 5-year period. So all of our goals have that 5-year time frame on them. And our objectives are those process or output measures that are really going to dictate how we achieve our goals or guide us in how we achieve our goals. So those objectives are anywhere from 1 to 4 years leading up to our 5-year goal. So again, just wanted to ensure that we kind of level set that this is the definition we were moving forward with as we created our strategic plan. Next slide, please. So this slide shows a few key milestones in our strategic planning process. We do have an entire appendix in our strategic plan that has a lot more detail on what the process was, but wanted to kind of pull out a few, again, milestones. So our priorities were identified starting in the end of 2022. We had 4 priorities. After some conversation, we added 2 more in early 2023 to end up with 6 strategic priorities. We then decided to establish work groups for each of our priorities, primarily to develop the goals and objectives for the priority, but also to support some additional components of each of the priorities, such as completing the health and racial equity review, which I will touch on in a moment. Some of these work groups were created from existing groups, and others were created specifically for the purpose of these strategic planning work groups. Another milestone or key part of our process was obtaining feedback from all of our staff. So supervisors contributed via survey, staff contributed at our October all-staff meeting. And the purpose of getting feedback from our staff, one of the purposes was to really identify the questions and concerns that they might have around the goals. We also wanted to assess alignment between the programs and the staff, the work that they do, and the goals that we have within our priorities, as well as identify some potential resources that we might need to be successful with our goals. Much of the feedback that we received in October at our all-staff meeting, we received a lot of really great feedback that's going to be used for implementation, and it's also been helping guide our communication from the HPE standpoint with the staff by knowing what some of those common questions were. The final milestone on this slide is the health and racial equity review. So all of our goals are being reviewed or have been reviewed by the work groups using a subset of questions from the GARE toolkit, or the Government Alliance on Race and Equity. And in the strategic plan, there is a link if you're interested in learning more about that toolkit. The purpose of going through this review was for us to consider the potential impact and unintended consequences that our goals might have on equity, both within our agency and with the community, and building those considerations into the implementation of the goals so we can hopefully mitigate some of those unintended consequences. And next slide, please. We'll jump into our strategic priorities. So in alphabetical order, we have our 6 strategic priorities: climate action and sustainability, community engagement, emergency preparedness, response and recovery, health and racial equity, mental and behavioral health, and sustainability, transparency, and stewardship. I will not go into all of the goals, but we do have numerous goals under each of our priorities. A little bit about the goal development. When possible, the goals were developed based on existing plans and initiatives, so we could try and avoid duplication of effort and also really amplify the work that we are already doing or that we have planned. So a couple of examples within emergency preparedness, response, and recovery. Those goals were pulled from our emergency management's 5-year rebuilding plan that they developed last year. And as we talked about a few months ago, our mental and behavioral health priority, those are our public health improvement plan goals as well. So again, where possible, we tried to pull from existing or planned work. As you read through the goals, you may notice that many of our goals focus on building our internal infrastructure and processes, which we believe is going to help us improve our work with the community members and the partners that we work with. Next slide, please. So jumping into what implementation could look like for our strategic plan. So right now, the structure that we have laid out is that for each of our 6 strategic priorities, there will be a priority lead, so 1 lead per priority. And their role is really kind of that coordination of the work going on in the priority. Their role will also be to facilitate a work group. The work groups might look different for each priority, existing groups, creating new groups, and the work group's role is going to be coordinating the actual implementation of the plan. Again, each priority is going to look different when it comes to implementation. They're starting at different points. One thing the work groups will be tasked with doing is creating an annual implementation plan. So each year there will be a more detailed plan outlining the activities that are going to happen throughout the year to work us towards achieving our objectives and our goals. And then part of the work with the work groups and the priority leads will be following our monitoring, evaluation, and learning plan to help us monitor and report. And Dahlia, if you can go to the next slide, I'll jump right into what our MEL plan, for short, is going to look like. So the purpose of the MEL plan, that piece of our strategic plan, is really to outline the process that we're going to collect and monitor progress on our strategic priorities. So this is specific to our goals and objectives of the strategic plan. We are planning to collect data quarterly. That data will be status updates for the objectives. So that would be things like just reporting, are they in progress? Have they not been started? Are they completed? As well as a brief narrative that's going to outline some accomplishments, challenges, opportunities for improvement, and next steps. With that data for reporting, quarterly, we plan to create just kind of a static report showing the status updates for the objectives. Biannually, so twice a year, we are hoping to have presentations for each priority that's going to talk about the progress for the priority. So a little bit higher level, not focusing specifically on the objectives, but kind of generally what's going on with the priority. And then annually, we'll develop a report that's going to summarize the progress of our priorities. And again, similar to the planning process, we do have an entire appendix devoted to our MEL plan with a lot of detail outlining what we plan to do. Next slide, please, Dahlia. All right, a few considerations as you are reviewing the strategic plan. Note that this is still a draft and we are still working on incorporating some feedback from our management team and still making some edits. Nothing too major, but you might see some new things when we come back in February, and we'll be sure to highlight those additions of those changes at the next meeting. As we look towards implementation, another thing to keep in mind is that the impact of the budget cut is still unknown or to be determined. So I think a key part of our next steps when we start convening the work groups to look at implementation is going to be assessing capacity. And we might have some more information then on kind of what our implementation is going to look like. In terms of next steps, once approved, we will work with our communications team to develop the final product of our strategic plan, creating the layout and the design, and then also sharing that strategic plan out with staff, with you, the Board of Health, with our partners, with our community. And then we get to move into implementation of the strategic plan, as well as our monitoring, evaluation, and learning process, which will be exciting to get to that point. And I realize this is kind of out of order, but to actually approve our strategic plan, we will be coming back in the February Board of Health meeting to request your official approval. And as Lexi mentioned, kind of wanting to follow that process that we used with the Public Health Improvement Plan. Between now and the next meeting, if you all have suggestions, questions, edits to help us incorporate those edits, as well as respond thoughtfully to those questions, potentially reach out to subject matter experts within our teams to get more information on the goals. We do ask for those changes and questions to be submitted to us by February 2nd to allow us a little bit of time to, like I said, incorporate those edits and get you the appropriate answers. Before I open it up to questions, and one more slide, Dahlia, if you wouldn't mind going to the next one. I really wanted to take a moment to thank and acknowledge all of the BCPH staff who have helped with this plan. This has truly been a team and agency effort. We had over 40 staff participating in our strategic priority work groups, and those staff are listed on there on the screen. Several of these staff members served on multiple work groups and dedicated time and expertise and energy into creating this strategic plan. So I really want to acknowledge and thank everyone who has contributed to this process. And we can go to the next slide. I feel like I flew through that. So if there are any questions, I can go back to anything, or I can open it up to the Board of Health. If you guys have any questions, if we can clarify anything about the process, I will open it up to you all.
Great, thank you for walking us through the slides, and I know we all received the draft document in our packet, so I want to invite other board members to weigh in with their questions or comments.
While you're thinking about your questions, I'd like to offer a couple additional points that were probably communicated in the packet, but maybe didn't quite rise as high to the surface in the presentation. One is that our intention is to further involve our community partners as we build out the implementation plans. That is in terms of the kind of capacity that we have right now, that's the space where we can also get additional information. And I'll give you an example in the mental and behavioral health space with our public health improvement plan. We will be using the behavioral health roadmap as a platform to build out that implementation plan. And the behavioral health roadmap itself has an infrastructure that is highly participatory with community partners engaged in that space. And the other thing I just wanted to mention was just in relation to the monitoring, evaluation, and learning plan. We mentioned that we would be starting with kind of progress updates, but our intention is also, as we get deeper into the work, as we have the implementation plans developed, that we will also be identifying qualitative and quantitative metrics to be tracking more specifically.
Yeah, Lexi, I think that was my big question. Were the quantitative measures, and will those be worked into it, since this appears to be mostly process-based and progress-based for now? I also had another question, and you brought up the behavioral health roadmap. How have the community feedback sessions been going? I ask because I know the city sent around an announcement for the one tomorrow, and I sent it to several people who are very interested in that space, who volunteer on several boards, and none of them wanted to join the meeting because of I believe the meeting says the intention is to discuss decolonization of healthcare, mental health care, or something along those lines. And so I'm just curious if we're reaching a broad swath of the community, or is it being somewhat limited by the language being used to advertise these community discussions? I think most people don't think in terms of decolonizing mental health. So how have those sessions been going?
What we have seen largely, and thank you for bringing that up in that comment. I appreciate you surfacing that. Just as a point of clarification, we don't coordinate those meetings. that's anchored over in community services. But I suspect that part of the use of the language is an effort to bring in some priority populations that often don't participate in the conversations and feel excluded if systems and structures are feeling overwhelming. But I hear your point. My perception is that there has been good kind of community level participation in the meetings, and that our institutional community partners are also all in with us, ranging from healthcare to mental health partners to other groups that we're trying to make sure that, kind of these broad goals that the behavioral health roadmap has, of which public health goals are a separate subsection, that those broad goals really are taking advantage and leveraging the resources across the community in a broader sense. But if you have folks that are hesitant to join, I would be very happy to talk with them and to invite them into the space, because we need all of our community participants to be working with us on this.
Yeah, I think my concern was just, so I know that we had talked a lot about the process for feedback for the strategic plan. And so do you think that the solicited feedback has been from a broad cross section, or has it been influenced at all by the language used to bring people into the conversation?
I'm not sure I'm the best person to answer that, but I am happy to come back to you with it. Indira has her hand up. Would you like to say something, Indira?
Yeah, I think I just want to share a little bit in this space. The mental and behavioral health feedback sessions have really been occurring over this last probably year and a half. So if you remember, the county commissioners, when they had their ARPA funding, they knew they wanted to do mental and behavioral health because the community had asked for that. So we had access to that information that they had collected, I think through surveys and different formats. We also had information collected through the roadmap process that is run by community services. So that included everything from what we do in public health, which is really focused on harm reduction, early intervention, and prevention, but it also included things that we don't do, like treatment and those other areas. And so when we did our feedback session, and Elise can jump in here at any time because she helped to kind of co-lead it, we called upon our programs to work with the community members that they work with, and we did a big call to any community. It was posted on social media, and then we also had conversations with people who were participants in the Works program and people who were youth who were engaged with some of our work. And so I felt like we had a very good representation on that feedback. And so I feel like over the past year and a half, we've really collected a lot of community feedback from different sources. I don't know, Lisa, if you want to add anything to that.
No, that was beautiful, Indira. The one thing I would add is that a lot of the community feedback that was gathered to inform the roadmap, that has largely wound down. I think that's what you were kind of alluding to, Indira. A lot of these recent sessions have been kind of learning opportunities for the community, is my understanding. And again, Lexi and Indira, if you understand otherwise, I'd love for you to chime in. But that's my impression, is that the recent community sessions that community services has been facilitating are largely learning sessions where they're gaining maybe general feedback, but the roadmap itself, and certainly our components of our mental behavioral health strategy, they were leaning on feedback gathered earlier in the process. And so these more recent sessions are more learning opportunities for the community at large and for partners. So that's my understanding of the focus.
And what I would say, Brooke, is it's a good point. And I'm thinking that we could do a reach out to Marcy Campbell, who leads that work at Community Services, and ask a little bit more about what they're working on. And then we'll get back to the board on that. And then the other piece I do want to mention is that in the mental and behavioral health space, there is a lot of equity challenges. There are a lot of therapists that don't look like me or other people of color. There are access issues for parents trying to get their kids access. There's just a lot of challenges. And so I think it will be interesting to hear from community services what their intention is with holding these sessions. But I think it's important to hear that you're hearing from people in your community that you talk to that they don't feel comfortable in engaging in those kinds of conversations. So that'd be good to know.
Yeah, I think the concern is that the language isn't very accessible. Most people aren't going to know what it means. It says something about decolonizing mental health. And I think you're really going to, that language speaks to a very small subset, and you might be missing the people that you most want to hear from in that regard. You might actually be missing the people who do suffer under institutional, the way the institutions are set up today.
Well, and just to follow on that, I think there's something around how do you know that you've reached a sufficient percentage of the community, right? Like, how do you judge that you have done the appropriate outreach to get the right input? And it sounds like it's a bit qualitative.
Yeah, I think that some of the lessons, and I'm just going to share my experience, and I think any of the programs who are specialists in this should feel comfortable to share. So some of the things that we learned during COVID is that, and this is something that the Community Health Division knows very well, is that if you send out like a survey or a survey monkey, you're only going to get a segment of the population that has access to technology, that it's in, they might have language access, reading challenges, literacy. And then also there's always mistrust with government. And so a lot of the work is actually boots on the ground, recruiting in person. We put up flyers, particularly when we're trying to reach some of our harder to reach populations. We have to use kind of different tactics. And so we can't just always use a survey. We have to have focus groups. We offer incentives and gift cards and ways for people to feel that, that their voice matters. And it takes actually a lot of work to do the equity-based approaches when it comes to hearing from everyone. But you're right, it's hard to kind of know when did we hit saturation. And the thing I think that is really important is just that, and I'm hoping that anyone else can jump in here, but on that mental and behavioral health spectrum that we do, we are really focused on prevention, early intervention, and harm reduction. So we don't do treatment, right? We're not, there are a lot of spaces on that whole mental behavioral health continuum that we just don't touch. And so I think a lot of times when you go out and you kind of ask the larger community what they need, a lot of times people will tell you I can't get in, right? There's treatment issues. There's not stability for family members who have, serious acute needs. And that's not something that in public health that's in kind of our, we set up our guardrails about what we have the resources to be able to do. I hope that makes sense. Does that make sense, Lindy?
Yeah, sorry, I was trying to find my mute button. It does. I think I would just challenge the team to think about what true community saturation is, right? Like, what percentage of the community would you say, and also, recognizing there's different channels you have to go through. There's, you reach people in different ways, but on total, did you reach X percent of the population, maybe broken down by certain types of the population? I don't exactly know what the methodology would be, but there's got to be some standard by which you could say, yes, we sufficiently engage the community, right? And I think to Brooke's point, where are we seeing barriers to our ability to access certain parts of the population where we really need to scrutinize and evaluate maybe our approach, right? So we learn from that and continue to advance the ball. But I think it's just a challenge to the team to say, let's be more quantitative about the way we're talking about some of these things.
Yeah, I
Elise?
appreciate, yeah, I was just going to chime in. I appreciate that, Lindy. And yeah, I think it's an excellent point raised. And I would echo a lot of what Indira shared and Lexi shared. The one other thing that I would just be remiss if I didn't throw in there is there's always opportunities for us to improve our reach and saturation, absolutely. And I want to counterbalance that with capacity of this team. The health planning and evaluation team was busy completing our community health assessment, public health improvement plan, and strategic plan this past year. So a little bit of the constraints we're seeing is on our end of wanting to strike that balance of reaching out to our community through those appropriate channels and reaching out through channels where there's trust and existing relationships, not trying to reinvent the wheel. And also trying to balance kind of what Indira alluded to a second ago, which is our community. We heard time and time again was feeling a lot of survey fatigue after the pandemic. There was a lot of community engagement happening from different sectors of the county. And so that was something that we were trying to be cautious of, is walking that fine line. So all that to say, though, you're absolutely right. And I think that as we look ahead to the future for future strategic plan, future public health improvement plan, setting those kind of goals around engagement, like what does that look like for us to feel confident in the results we're getting, I think is a great idea for sure.
Yep. And I appreciate all the context that you just gave too. So this is a work in progress for sure.
I'll just make one more comment on that, Lindy, because I think it's a really important point. That the county is working with a consultant who I think is actually very good to develop a community engagement framework. And I think this is the perfect kind of question for us as a county to be able to answer and to create a county standard for what does it mean? And so I look forward to bringing that kind of question into that group, and we're going to have a meeting very soon. And the other thing that I would just raise up a little bit is that, we have a tendency to recognize a few different kinds of community, right? What do we mean when we say community? We've had this conversation before. And just to highlight that, we have institutional partners who are either service providers or institutional partners that are a little bit more community-based organizations focused around building community power and represent the voice of a particular community interest group. And then we also have individuals. And so thinking through kind of, what's the right balance in those kinds of cross sections too, I think is really important. So I appreciate your comments, and we'll make some notes.
Awesome. And then the only other kind of overarching comment that I wanted to make, or just have some discussion around, is just the measurability of the strategic plan. It's very hard for me to read this and not see mostly process. And I just worry that I think maybe under increased scrutiny and under a microscope to be clear about our actual measurable outcomes. And I know I've raised this before, and Lexi, I know you've talked about it before, and I fully recognize that there's something around a multi-year journey, right? Like you can't necessarily commit to everything day one or year one, but my read of the documents is that the goals, if I'm getting the right language in this context, I'm just going to pull it up to make sure I'm saying the right thing. But we're saying the goal of all these goals, and there's many of them, are the outcomes that we look to achieve in 5 years. Well, I don't see anything. I didn't read anything in this document that helped me understand how we're really quantitatively moving forward from a public health measurability perspective. And so I think broadly, I'd like to see more measurability. I don't know in what areas that would make the most sense, but I'll turn to mental health as an example. If you read down the bulleted list in the slide deck, strikes me that every single thing that's listed here is about, it says words like increase, pursue, develop, but that doesn't tell me what the goal would be the actual goal would be at the end of that, right? Like, so if you want to increase community understanding and capacity to improve mental and behavioral health through these means, what does good look like? And so this is where I'm struggling with this document. And I'd like to really press the team to say, again, doesn't have to be every single goal, but where are we more confident that we can actually peg something to say, quantitatively, we expect to move the ball from here to here.
Yeah, so that's a great point. Oh, go ahead, Elise. I was just going to mention some of the conversations that Elise and Rachel and Indira and some others have been having, Catherine, about how we are trying to move towards data-driven decision-making and accountability. And you'll hear more, I think, next month on next month's agenda about what our plans are in that space. And it includes 3 general areas. One is about budgets, and one is about the strategic plan, and one is about other agency programs and priorities that aren't captured in the former 2. And I think that we're trying to move towards that. I think the what's a little bit more of a challenge right now is that there are a lot of distractions in public health at the moment. So we are trying to be attentive to where we're investing our time and what we're asking staff to spend time on as we go forward. But our intention is to have a lot of those reportable metrics and measures. A chunk of them will come in the early part of the year, and another chunk we'll have by the end of the year.
Yeah, and Lexi, I really appreciate you guys you specifically, but the team educating me around the journey that we're on. So I'm really supportive of the evolution we're taking here, and I just wanted to make sure I articulated that right in this public forum, so that those that are listening in understand that we're moving more and more in that direction, and it's not self-evident today, right? And I think that's right. Just important, right? So anyone digesting this from a public perspective will understand that this is not lost on us collectively. So yeah, okay, thank you. And I'm sure you anticipated this comment from me. So.
Yes, and I would just add in that you're preaching to the choir. Our HPE team is very well aware of it. It's been a topic of discussion. What Lexi said, I would just echo entirely. And the one thing I would add is, as Rachel mentioned her presentation, what you're seeing in this first iteration of the strategic plan, again, a lot of the direction we received was to build off of existing plans and to work with existing groups to amplify the work that was either already planned or in progress. And so hence what you're seeing in the plan in this iteration is really focused on that. And there was a strong acknowledgement amongst our team and the management team that as this plan moves forward, we want to set up systems in place where we can be monitoring this in a more, or evaluating this plan in a more quantitative manner. So an idea that we have been casually discussing, are there ways to survey staff on an ongoing basis that would allow us the opportunity to gain metrics that would speak to elements of the strategic plan? What are, data collection efforts already underway at the county level that nicely align, or we can work to align with what we have in the strategic plan. So all that to say is we hear you loud and clear, and that is definitely a direction we want to go as well. So thank you for speaking to that as well, Lexi.
Awesome. Thanks, guys.
And
appreciate it.
And just to clarify, will some of those metrics be included before we vote to approve the strategic plan, or is this something that we're waiting to see that will evolve with the plan?
Our expectation is that the metrics will begin to evolve as we are able to dive into the implementation plans and clarify what is it that we're trying to accomplish and what are the metrics that tell us if we're making that change in the community. Are we able to move the needle? Are we able to scale? Are we able to whatever those goals are? And I just also want to reiterate that, we have 2/3 of our funding comes from budgets, and excuse me, from all of it comes from budgets. 2/3 of our funding comes from grants, and a lot of those grants have reporting requirements that go with them. And so part of our thinking is, when we say we wanted to build on what we already had, part of that was because, we're not going to be handed a new tranche of funding to go and do entirely new stuff. We have great confidence in our programs, but we also know that we need to have more transparency with the community and with the board and with the county about what we're accomplishing and be able to tell our story better. And we also need a mechanism for more intentional learning. And so those metrics are going to help with all three of those components, but we do need a little bit more time to get to the nitty gritty of what does this look like and what should our community expect to be able to see that we think will be progress, and we'd love to hear from them about whether they feel like that's progress.
Yeah, and I do want to also say that strategic plans are usually documents that are written and then stuck on a shelf and nobody ever looks at them again. And the best strategic plans are ones that are living documents that continue to be edited and revisited. And I think that this is an area where we can continue to revisit and add additional information. I also think, as noted, we really don't know the impact of these budget cuts yet, and that may also alter some of the work that we prioritize. I mean, I think the priorities that are identified, the high level priorities that are identified, are going to be consistent, over the next 5-year period. And I think we're very committed to that as a board, and I know the staff is from all the work, but we are going to have to figure out how those budget cuts are going to impact our work. And so I think the strategic plan, if done right, we'll have several opportunities for us to revisit and add to and amend and, some more specifics within that.
And to be clear, that's our intention. We also agree that strategic plans don't go on shelves.
I mean, I think I'll just continue. And I do want to say that the behavioral health roadmap rollout, it sounds like, was led mostly by community services and potentially, I don't know how much influence public health had on that. And I'm glad, Brooke, that you raised some of your feedback that you're hearing, and that should be listened to and addressed. But one of the questions I had, Lexi, was about the strategic plan opportunities for where, when is the public invited, or how is the public and our partners invited to weigh in on that? Because it seems like it's been mostly an internal process, and I understand why, because we've had so many plans that we've had to produce this year. But you mentioned it, Lexi, and I'm wondering if you can just say a little bit more about what that looks like as the strategic plan gets shared with the broader community.
Yeah, absolutely. And we can also highlight in the strategic plan how community partners have already contributed to a lot of the work. It hasn't been necessarily completely consistent because we're in different spaces, in different processes, in different topic areas, for instance. But we would be happy to make sure that is reflected, both kind of what the participatory aspect, the external participatory aspect has been for the priorities so far, and also what our intention is going forward. Indira?
Yeah, I think that's a really good point that we should probably highlight in the strategic plan. And, some of what we're doing is a lot of internal facing systems building as we launch off the ground for some of the initiatives, which are kind of more on that early phase of the continuum. But if you take something like emergency management, during COVID, we did after action reviews twice a year. We also did after action reviews with our partners in the community, our community ambassadors, people we worked with. So a lot of what was presented is presented in the emergency management are all the themes and everything that emerged from all of the after action. So I think it would be good for us to demonstrate that we have been listening to the community. We have been listening to what they are suggesting. And we could definitely add that in.
Yeah, that's the beauty, right? Is that if it's built into your work, if that engagement is built into your work, then you don't have to make a special initiative necessarily. But you've been collecting feedback in an ongoing way. But I think really being explicit about what our intention and expectation of ourselves in that space is helpful.
Yeah, I agree. And I think, giving a specific example like that about, how this has informed the work, because again, if you're just reading it and you're not aware of all that went into it, it doesn't look as externally facing as, I know that it has been. So.
Thank you.
And I would be remiss if I didn't also say, and looking back on the conversation around the behavioral health roadmap rollout, I do really appreciate the effort that goes into trying to reach communities that have not been invited or felt like they have a voice in the conversation or at the table. And so I know that it sounds like in this case, maybe it's swung back to where there's some feelings of exclusion from folks who maybe historically have been more included in conversations. But I do really appreciate the efforts to reach out to, in particular, communities of color, low-income communities that have been often left out of conversations and are still continue to be left out of a lot of public conversations. So just appreciate that too. Okay. Are there any other strategic plan questions, comments? Okay. Thanks, Rachel and Elise and the whole HPE team. And I know it's been a really busy year for your team, and plans are a lot of work to build and to put together. So thanks for all of that. And then now the hard part is actually implementing them. So more good work ahead, but thank you. Okay, our next agenda item is item 6, the Team PH Board of Health. Jordan, I think this is you.
Take it away.
Yeah.
All right. Good afternoon, board. My name is Jordan Thomas. I'm the Business Operations Manager and Board of Health Liaison for Boulder County Public Health, and I use she, her pronouns. Let me share my screen. So Dahlia, whenever this is done, we can swap back over to presentation. Let me pull your faces over here. All right. So as part of my role and our overarching sustainability, transparency, and stewardship strategic plan is just increasing efficiencies, collaboration, and overall board development. And this idea actually started from, hey, does the Board of Health have a shared calendar? And I went through multiple iterations of, one, is it legal? Like, is it board business? Is there's this, other compliance that we have to take into consideration? Dahlia had mentioned having a team situation. And so I just went around and poked to see what we have at our fingertips. And I was able to work with the county attorneys to get our Team PH BOH SharePoint page approved by them. So board members, you cannot conduct board business within this. So we are all safe from open meetings. This is a private internal Boulder County SharePoint page that you all have access to. I shared the link with you this morning. If you have issues with it, we can talk offline just to make sure that you have it bookmarked and ready to go. So the beginning part of the page, this all comes from our Board of Health website, but it's there just as a reminder, has your lovely pictures on there that are on your security badges. And then the next section is split up between a left-hand side and a right-hand side. So the left-hand side to me is more, this is like the actual happenings of the Board of Health. So if you click on this first link right here, it opens up a smart sheet that is linked to an overarching larger smart sheet that Lexi and I have that we would kind of start planning out our 2024 Board of Health agendas. So this just pulls that high level information for the entire year. So January, this is the meeting that we're in right now. It shows all of our agenda topics. Includes retreat information. Do we have an executive session coming up just for that internal planning? And you can go through and see a high level snapshot. Then if you exit out of that, the next section is that shared calendar that kind of sparked all of this. You're able to go through and click to see what's coming up. Even during the HPE presentation that was just happening, you know, the February 2nd deadline for the edits, I went ahead and put that on your calendar. So you can go in and add it to your personal calendar by clicking this right here, this add event to your calendar. It opens up like an iCal. You can download it and save it. Same thing with any type of retreats, or, you know, the Microsoft Teams link is there as well. Going over to this right-hand side, this to me is more of that like resources for the internal and external. All of these up here are external links. The first is the Board of Health calendar. So looking at it more as it opens, there it goes. I got a monthly view, so you can click through it and see what you have coming up in February. I will also be working with our supervisors, I think at our February or March supervisor meeting, to start collecting those like programmatic team meetings. So all of the June Pride events, or if there's like an immunization tent at Cinco de Mayo or something, so that you're able to go and visit with our Boulder County Public Health staff. The next few links are for CDPHE, so this is where you can go to your annual board training, if you want to go to our actual Boulder Health website, our YouTube channel, things like that. And this next section down here are all of the finalized board packets. So you're able to click into it and see all the ones that we did for 2023. The best way to view them is to click these three dots right here and actually download them, since they have those hyperlinks that we've started using, since we have lots of supplemental material. And then same thing with the presentations. All of these are the finalized ones, so you can go back and review. The next one is something I'm really excited for, because it's a interactive Board of Health notebook. So this just like introduces the notebook itself. The meeting guidance kind of gives you the high level, like we have all these different meetings. This is what goes into the meetings. And this is chairing a meeting. So this actually started when Landry had a sub in for Morgan. I just copied and pasted it into here. So this gives you the actual language of how to chair a meeting, including like the ayes and the nays for any types of motions. The next section is for our recruitment. So this is our current Board of Health members. The recruitment process that includes the difference between vacancies and reappointments. So Landry, you're up for reappointment this year, so this is the process that we will follow. And listing out just additional information from the Colorado State statute and our current application questions. Then moving from recruitment into onboarding. So this is the process that Amber just has started, starting with our program review. We met with all the division managers and key staff for about 2 hours. So starting to actually like outline all of this and get it in writing, because before it was kind of just, this is what we do. So this is a more formalized situation. Same thing going over like board logistics and county trainings, things like that. And then the last ones are the administrative policy and financial oversight and like powers and duties of the board. And then in relation to that, of the public health director, since they work closely together. All of this is based in, you know, state statute, our bylaws, things like that. And if there's any other questions as far as like, if I missed anything in the notebook, we can always go in and add. This can be a working document as needed. Lastly, in this little documents page is our bylaws. So this is like the internal bylaws that this Board of Health has drafted and that we follow. And the last part, this is just contact information in case you forget our email and you can't find us. You can hover over us and it's not pulling up, but you should be able to click into it and email us right from here. So as you click through this, if you think of anything like, hey, this would be really cool, or we could try it this way, shoot me an email and I will see if I can incorporate it. So really excited about this, and yeah, it's just moving us towards making my life easier and my team, and hopefully your lives as well. So Dahlia, I'm gonna stop sharing and you can share.
Well, this is so awesome, Jordan. Really, thank you. Yeah, thank you so much for doing this. This is a huge resource to all of us on the board and any prospective board members and the community, and really appreciate all the work that went into this. And thanks for keeping us organized and and you know, I think a few of us need to send you a better headshot, but no, it's it's no, really a great job. Thank you so much, Jordan. Really,
awesome. Thank you.
Really appreciate it. I look forward to using it. Okay. Item number 7, this is a standing agenda item for our board right now, is continuing to revisit the budget as we are in a transition period here. So
Thank you. So, right. I'm sorry, can you go back one? Go back 2. Nope, we're going the wrong way. There we go. And we are still seeing presenter's view, Dahlia. There you go. All right. Thank you so much. Go back one slide. Great. Okay, so thank you very much. We wanted to be attentive to our commitment to making regular updates on our budget progress. And so we're going to talk a little bit about, recognizing that the reality is with the holidays, it's only really been a couple of weeks of work since the last Board of Health meeting, but we do have some progress to report and want to keep you up to date on what's going on in this space. So I am happy to turn it over to Desiree and Catherine to get us started.
Thanks, Lexi. I will start first and then Desiree will take it from here. So hello, everyone. I am Catherine Palmer, your Director of Admin and Finance. I use she, her pronouns. There were 2 areas I wanted to provide updates to you on in terms of the budget work. In late November, there was a number that was put out that we did not vet, but just want to use that as a reference point and then provide an updated figure. In late November, saying that we had roughly $10.4 million left that had not been spent. As of today, Desiree pulled the numbers down for me. As of today, we have 4.6 million remaining, and that's what we see in our Oracle. So it's about a $6 million difference from what was said in late November. And just recognizing that our expenses get pulled into late February. So we still have roughly a month and a half until we'll see a finalized number in that space. In terms of some of the work that's been happening, we have been holding quite a few meetings to discuss next steps and where we're going that follows that phased process that I know Lexi will touch on when we wrap this conversation. But one of the big components that we got out today were the instructions for preliminary budget reductions with each of the teams. And it was taking a look at what we can take off the top that we felt like would not make a huge impact to the teams, and really was to help promote an exercise with them to look within their budgets and see what was possible, flexible, and where things could be moved. So those are with each of our divisions and sections, and we are asking for them to provide updated lists as well as ideas of their own on February 6th. So we'll have an update then and generate those into our current budget standing and then see what we need to do next after we get the feedback from the teams. So those are my 2 updates I want to provide, and then I will pass it over to Desiree after Desiree's component, and Lexi is happy to take any questions that you may have that I didn't touch on or that I did touch on and you just have more questions about. Thank you.
Can I ask
Desiree?
a quick clarifying question, Catherine, on something you just said about the numbers? The 4 million that you said is still there that doesn't account for year-end expenses that won't roll in. Does that also include our reserve balance?
So yes, that is within that total amount. So if you look at the total amount, which for us was about 27 million, a little bit over 27 million, we have 4.6 million remaining of that. So it would include our entire budget, which would be our reserves.
Okay, thank you.
Yep.
All right, Dahlia, will you move to the next slide, please now? Thank you. My name is Desiree Kazarosian. I'm Boulder County Public Health Finance Manager. and I use the she, her pronouns. I am going to give you some system updates that we've been working on and some changes that have happened since the budget announcement. Some of these items were in progress before this first change, where we received a dedicated employee at the Office of Financial Management that is now working through all of public health's needs with me as the point person and all of the systems, all the requests. So where before I was going to various individuals for things, we now have one common point of contact. And number two is the working through the system requests. So Oracle is our financial system. Oracle has been at the county for about 4.5 years. And OpenGov is the new budgetary system, which has been in place for a little over a year. So that budget system is not something that we use as a point of reference, but it is a county resource that we're required to upload our budget to. Currently, it has some limitations that doesn't make it very usable for us. So we're still using our tracking spreadsheets. So the areas that we've been covering with the Office of Financial Management include tracking indirect costs and projects and the financial systems. This is an important aspect for us, but is unique to the county. So it wasn't developed when Oracle came online. So we've been taking several creative approaches to this, and the Office of Financial Management will decide ultimately what is allowed in this space with the system. So this is something we're working back and forth and have a couple more meetings with them about. The next item is the visibility of the budget to actuals for grants and projects. So as Lexi mentioned, we have a large amount of our budget is grant related, and we need to see where we are at any one point of time in our spend down. So that includes our indirect and what we've collected, but it includes seeing how much more we have to spend down. The current systems, we're having a hard time combining those two aspects, the budget aspect and the actual aspect. So we were hand building these reports. So they are changing some of the functionality that's available, and we are now getting our first glimpse of a newly built project budget to actual report that is available in Oracle. So that is just rolling out. It's something that they're looking at rolling out countywide. Because we're not the only grant-funded programs in the county. So there's a lot of items that have been waiting that we're now spearheading in this process. So the other items are reporting overviews for management. So our managers can make better decisions, see where their divisions are, see where we are as a department. Interdepartment charging, so we're not cutting checks between us and other county departments. Fund balance reporting, which is something we're always very interested in, but doesn't really change in our financial system, but usually about once a year, we can hand, excuse me, hand calculate the changes, but we, in the system, it only changes when we're doing our audits or preparing for our audits. The last item is payroll reporting, and we're just in the process of implementing Dimensions, and Dimensions is currently not speaking to our other programs, so that's kind of a to be determined item on our list. So one of the big items of focus was PH13. PH13 was being used to track personnel expenses only, but now the county is requesting that we use it for all county expenses. So we are going back and trying to reallocate or reclass items in 2023 and are pushing out information to try to make that easier for us to do here going forward in 2024. So those are the highlights of the items that I've been working with the county on through their contact and our working group. Are there any questions related to these items?
Yeah, thanks, Desiree. I mean, I have a question about the capacity of your team. This feels like a lot of work. And I know it's been a lot of work for some time. And I know that the board is unified on wanting to support you in addressing all of these changes and ensuring that we can really get clear information to the commissioners and to the public and to all
Right.
the departments. So do you feel like you have right now the capacity on the team to be able to get through this, especially within a high pressure timeline? You know, and if not, how can we supplement that in, what are the opportunities to ensure that you have the capacity that you need on the team?
Thank you. I appreciate your thoughtfulness there. There are a lot of moving parts happening in this area. My team has been great, but yes, we are limited, and actually we're down 2 staff members since year end. So we will see how our capacity is going forward. A lot of this work is being done through some of the specialists as far as the development. So I am pulling in my team members as it applies to their positions. So for example, for the indirect costs, I'm pulling in the lead grant accountant now to discuss how it affects her, because she's building out this information for the programs. And it's been a lot for everybody, so across the board. So I don't want to discount the stress that these kind of changes are making across the department. But right now, I can't identify a resource that we would need, but I will definitely keep that in mind going forward.
Yeah, great. Because again, I think that there is full support from the board to say, what do you need to ensure that we can continue to move rapidly in this direction, and if there are additional resources that we can put, this is a high priority for the board. So
right.
I do want to, and I think the other thing I will say is, having been on the board now for, this is, I don't know, year 6 for me or something.
Okay.
A lot of our challenges in this sort of in the finance and tracking and accounting is that we had various systems built by different people in this position over the years. And so what I know that you are championing, Catherine, is really having this consistency, so it doesn't depend on having a consistent person in that, the same person in that, who understands all of the tracking mechanisms. And I think that's so important for this department, and the clarity in the numbers, and just being able to not be at sort of the whim of whoever is leading at that time, because we did have turnover in that position for a number of years, and we're just so thankful to have your leadership now, Catherine, and what you're doing to try to build a more sustainable system.
Catherine, do you want to speak to that?
Yeah, thanks. And Morgan, I really appreciate you asking the question. And Desiree, I really appreciate your diplomatic response to the question. I think what I would acknowledge is, in this moment, that we are in like kind of a finite moment. Right now, there are multiple things happening. So we have the dimensions onboarding, and like Desiree acknowledged, it's not speaking to our budgeting, which means that we can't pull down the numbers. We're not sure how that's going to happen yet with our salaries.
It's our
and
new
how that'll
payroll system. Yeah.
How that will show up in the budget. So that's one component, which you can always expect when a new system comes on board, whether or not it'll work. You don't know what's going to happen. But the other thing is that our audit is going to start fairly soon, and we're going to get budget instructions for the next year. So we have this very small window where we can do some of this work. And even right now, it's not like it's happening in a silo where we just get quiet time and we can just sit and work on this. Unfortunately, that's not how our day-to-day works. There are budget closeouts. There's all those other things happening. So I would respectfully disagree with Desiree and say that we do not have enough resources right now to be able to get us where we want to be quickly, recognizing the pressure and timeline that we are working on. And that is a space that I have spoken with Lexi in. And part of it has to do with what Desiree also acknowledges, that we are down to staff. So we are working a lot of hours and trying to maintain and answer the questions that are being asked of us.
And I just want to be clear that I support getting us more help. And, you know, it's that catch-22 of you have to stop what you're doing and focus on a pretty intensive hiring process to get that help. And there are so many urgent demands that I think it's just very difficult right now to figure out what the best path forward in that space is.
So you mentioned hiring demands. What if it wasn't full-time? What if it was a consultant? Have you explored any options there to have somebody come in? And then I think the second question is, I know we've acknowledged that it's a tight timeline. What's the timeline that we're looking at to get away from all of the spreadsheets and be fully automated?
I'm going to make that a sticky note, and that's going to be my end goal for the year. Get away from all the spreadsheets, because I feel that way, Brooke, very deeply. So a couple things in this space is we could look at hiring hourly. That would help a little bit. I will say in the past, we actually did bring a consultant on, and it was not the benefit that we hoped it would. And nothing against the consultant. They were very skilled in this space. It's just our process and program is so dynamic and so nuanced that it took a lot of time just to get them up to speed. And it was time we did not have. So we have to pull that energy away to be able to even explain what our systems are doing. The other thing that I was remiss to even share is beyond the positions that were down, if we were to add any other positions, well, we've just faced some pretty deep budget cuts. So it's trying to find even more money to bring in even more resources to help us in this space. So in terms of the question that you have, Brooke, and I just want to double back on some of the work that Desiree is doing and really acknowledge that she is spearheading and leading the charge across the county, not just for our department, but she has been for roughly a year now asking for some very specific reports that would get us out of Excel. And we're finally seeing traction. And we're also seeing appreciation from other departments in the county that are like, oh, I didn't even know this was a possibility. So she has really leaned in, and we're so appreciative of her skills in our department, because it has helped move us forward more quickly than I think we would have been able to. There's two components in terms of timeline. One is to balance our budget better than it is at the moment. So we're not pulling as much, and maybe see where we can find some reserves. The other component is to get us into a better budgeting process. And we don't think that's feasible by March of this year, but the phase process kind of walks us through what we're seeing in that space. But it is a lot of work to get us there, because not only will it be a ton of changes of system, but it's also a cultural change within our department to communicate and be transparent in that space.
All right, Lexi, did you want to lead us into the phase?
I'm going to make it super short because I know that we are all tired tonight, but just wanted to give you, if you can go to the next slide, Dahlia, please. Thank you. A quick update on the implementation of our phased approach, just to let you know that we are seeing increased alignment already with other county departments. And I just want to underscore that Desiree and Catherine have demonstrated tremendous leadership in developing templates that OFM plans to adopt for reporting from other departments. And I do believe that one upside of this spotlight on BCPH's budget is that we are seeing a much greater commitment from OFM and HR to quickly work with us to get some of the historical challenges resolved, which I am very appreciative for. And and I think it's going to put us in a much better position. In terms of the items on the phases 1 and 2, you'll see a check mark for stuff that we have completed. It showed up as a little box on your screen. On my screen, it's a little arrow that shows that those are the things that we've begun and are in process. Things that are still represented in a point are things that we are preparing to start. So I would say that we are largely on track for staying within this phasing approach. We've made progress on building a strategic budgeting framework and decision-making process, but we're going to really be having those deeper conversations with management team and others in the next few weeks. As Catherine mentioned, we are now in the process of gathering data and proposals from staff on where they see opportunities. We are looking at, as Desiree mentioned, that county general fund line in Oracle. We've been given new instructions to make it a little bit more transparent how the general funds are being spent. And just to be clear, we have always followed the instructions, but that seemed to be a space where the Board of County Commissioners were getting confused about what was actually being spent there. So we got new instructions. And so that is an additional piece of work that Desiree and her team are leaning into, is how to move some of the previous allocations around to make it more transparent and accurate from the commissioner's perspective on how they want it. And we also are going to be really focused on identifying areas where we as BCPH staff would like to clarify expectations and needs from and with both the Board of County Commissioners and the Board of Health in the next few weeks, so that we all know that we're working towards the same ends. So just to wrap, I appreciate everybody's time tonight. We will try to make sure that what we're presenting you every month is as succinct as possible. And I'll have a conversation with Morgan about what the best kind of checkpoints are for our regular check-ins, but we did not want to neglect this check-in in January.
Great, thanks, Lexi. And I do think, again, that this is such a high priority for the board that we want to continue to have it be a standing agenda item, and really appreciate all of the hard paddling that's gone on even in the last month since our last meeting by the finance and budget team. So thank you for keeping us updated, and thanks for all the work that you're doing, and we'll continue to support you. Okay, our agenda item 8 is the director's report.
Okay, it's going to be, I'm going to say a couple of things because there's a couple of things that I just want to highlight. Respiratory infections are pretty bad right now across the board. The dimensions transition this is a county-wide transition. This is not public health specific. To move from Chronos to dimensions, timekeeping, and payroll system has been challenging. And so that's an extra stress on that A&F team and on our staff, but we will get there. And then I want to do a little bit of bragging on our staff. You may have seen in the director's report that Chris Campbell, our emergency manager, was awarded the Congressional Service Building Bridges Award in December, presented by Congressman Joe Neguse. It was based on Chris's dedication, expertise, and unwavering commitment to ensuring our community's safety during the COVID pandemic and the Cowwood, Left Hand Canyon, and Marshall fires. And he was presented with that service award. Similarly, at the same celebration, one of our community substance abuse prevention youth research assistants won the Dorothy Rupert High School Service Award. And we were just really proud to work with her and to have her as part of our staff, because, we have a practice of employing youth as staff in our organization. And it was wonderful that she got that national award. The BCPH Genesis program manager and emergency management coordinator. So Mary Faltinsky and Chris Campbell were selected for a NATO virtual learning collaborative to train maternal and child health and emergency preparedness and response professionals at local public health departments on integrating MCH considerations into emergency planning. So that was a lovely kudos. And then the last piece is just on the CU air monitoring equipment that was mentioned in the director's report. This is a critical piece of equipment for us to continue to gather data on air quality in Boulder County that drives an enormous amount of our policy work at the state level on air quality. And I have been in touch with CU and we're working towards a solution to be able to continue this important work. So I'm just waiting to get confirmation, but I am optimistic that we're going to be able to find a solution for that.
Hey, Lexi, do you want to share about this weekend's the shelter?
I was going to mention it in new business.
Okay, that sounds good.
Thanks for sharing all the kudos for various team members, and congrats to the team members who were recognized by outside agencies. Always nice when others recognize all the good work that's happening. So thanks for highlighting those. Any other board questions about things that were captured in the director's report? Okay, item number 8.
Okay.
New business.
2 things real quick. One is a new brag that our fruit and veg program was covered by NPR recently, and we will include a link to that in next month's director's report. So more to come on that one. And I just wanted to mention that our staff had a remarkable response to the extreme cold weather event over the past weekend. It was a holiday weekend and our staff was amazing. We had led by Chris Campbell, Colleen Sinclair, and Carrie Middleton from emergency management team. And we had, I think, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21 staffers who were at the emergency shelter. They did everything from distributing PPE because respiratory infections are so bad right now, to basic hygiene issues, to managing diabetes, treating frostbite and alcohol withdrawal, harm reduction work, hospital transfers, collaborating with mental health partners and co-responders to provide supports to those who were sheltered, and all of the planning and coordination and reporting of such a response. The shelter went over census a couple of times, but the staff managed it really gracefully. And we also had A&F staff who are going to be supporting kind of the cleanup and the admin cleanup afterwards, Desiree and Amanda and Emily. And then we also had 11 Medical Reserve Corps volunteers. So it was just a really amazing demonstration of collaboration. We got a lot of kudos from the Office of Disaster Management, from Community Services and our other partners in that space. And these teammates, I mean, these were, this was also, we had our medical officer, Bob Belknap, Stacy Farman, Soda Sonoda, Betty Tovar, our harm reduction team, Madeline Evanoff, Georgia Babatsikos, Eliana Letterman, Becky Molansky, Kelsey Wiegman, Emmy Friedman, Amy Hunter from our IZ team, Mary Faltinsky, Felicia Kane, Sean Hollister, and Giselle Noel. I had to get some of those names out because we're just so proud of them, and they really remind us all of what being the best in public services means to our community, and I couldn't be prouder to work with them. And I am quite convinced that this emergency response supported by the city and county saved lives in our community this weekend. And I just want to thank all of them for the leadership that they demonstrate.
Hear, 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 hear. And in the times of emergency, that this team continues to rise to the occasion and serve our community in our most stressful times are just really meaningful. So thank you. Thanks to everybody, and thanks, Lexi, for sharing individual names too, because there are a few folks that we get to see regularly, but it's really important to highlight all the behind the scenes folks that we don't see as often in this space. So thank you. Okay, I think, are we to the end of our full agenda? Okay. Item number 9, adjournment. Thank you. It is 7:54. There's my gavel knock. Thanks everyone for your good work. I appreciate your time this evening.
Thank you so much, everybody.
Thank you.
Thank you. Board.
Thank you.